I can almost guarantee that if you're watching this video, you have seen an ad that looks like this before. You know, the ones that ask if you're scared and pregnant and alone and offer things like free help and information on options. But if you didn't know, these ads are actually not telling the full story, because at face value, this kind of looks like an ad for a free medical clinic, but they're not. This is actually an ad for something called a crisis pregnancy center. Crisis pregnancy centers are organizations, most often Christian ministries, that misrepresent themselves as medical clinics in order to draw in pregnant people looking for support. However, most of the time, their goal isn't actually to offer unbiased support or real information. Their goal is actually to persuade pregnant people away from getting abortions. To achieve this goal, these organizations are not above doing things like fear-mongering or just spreading blatant misinformation about abortion to ensure that the people that they say they're helping are choosing the options that they want them to choose. And these crisis pregnancy centers are a huge problem in Canada, acting as both a physical and a cultural barrier to abortion access. And the reason that I said that you'd probably seen one of those ads before is that these organizations are everywhere. In 2016, the Abortion Rights Coalition of Canada identified 180 of them while doing a study. In parts of the country, it's going to be easier to find a crisis pregnancy center than an actual abortion provider, which is why it's so important that we talk about the reality of abortion and abortion access to combat the misinformation that they're spreading. In recent years, ARC has done a lot of work trying to combat these crisis pregnancy centers and is continuing to do that work. So if you'd like to hear more about that, stick around on this page. We already talked a little bit about what a crisis pregnancy center is and how they spread lies and misinformation. However, we didn't really go into depth about what those lies and misinformation are. A little while ago, the Abortion Rights Coalition of Canada did a study on over 100 websites that are linked to 143 crisis pregnancy centers in Canada. These are some of the main takeaways of what was being promoted on those websites. 38% of them had no disclaimers that they don't help with things like abortion and contraception. 5.6% of them claimed there was a link between abortion and breast cancer, something that is not scientifically accurate. And 18.9% of them cited other medical risks of abortion that were either wildly exaggerated or completely untrue. 11% claimed that artificial contraception is not reliable. 13.9% advocated for abstinence or discouraged sex outside of marriage. 81% presented adoption as a better option to abortion. 74% showed evidence of religious motivation, agendas, or outlooks, but 15% were not upfront about these. 42.7% did not have any disclaimers that they're not a medical facility and that they should not be providing medical services. 9.8% actually said they do offer medical services like STI testing and ultrasounds. 2 of these websites mention something called abortion pill reversal, which is a unproven and potentially dangerous medical regimen. 92% offered workshops or classes that aren't directly related to abortion on things like prenatal care and parenting, and 16.8% required anybody accessing their resources to attend these programs. That's just a small insight into what crisis pregnancy centers say and promote to further their specific agendas. And by listening to that list, you can clearly see why we can't let crisis pregnancy centers pretend like they're an authority on anything to do with abortion or reproductive health care. So that's why we're going to keep engaging in discussions about abortion and reproductive health care and reproductive rights in a way that is transparent and honest, because somebody has to. We've talked quite a bit on this account about crisis pregnancy centers and the harm that they do by posing as fake clinics when they're actually anti-choice organizations. One thing we haven't done yet, though, is looked straight at the source. Here are just a few of the worst quotes that we have found on the websites of crisis pregnancy centers. You may be interested to know that in Nova Scotia, there are many, many families waiting to adopt infants. There are older children in foster care who are available for adoption in Nova Scotia, but the fact is that there are very many families in Nova Scotia looking to adopt infants today, but a lack of infants available for adoption in this province. As the Department of Community Services website states, there are fewer infants available for adoption than in the past, and there's a lengthy waiting period to adopt infants. That one is courtesy of Valley Care Pregnancy Center in Kentville, Nova Scotia. Looking for an abortion in Chilliwack, BC? Here are some important questions to consider before an abortion. Are you sure that you are pregnant? Do you understand the abortion procedures that are available to you in the Fraser Valley? Do you know about the physical complications that can result from an abortion? Do you know about the emotional complications that can result from an abortion? Do you know where to go for help if you experience a complication? Do you understand the stages of fetal development? That one is from the Cherish Project in Chilliwack, BC. Abortion carries the risk of significant complications such as hemorrhage, infection, and organ damage. Serious medical complications rarely occur in early abortions, but increase with late abortions. Obtaining complete information on abortion-related risks is limited due to incomplete reporting and lack of record keeping related to abortion complications. The information that is available points to the following risks. And that one is courtesy of Instant et Enquête from Montreal, Quebec. As you can see, these quotes are condescending, infactual, and pretty coercive. Looking at quotes like this is a great reminder that once a person or an organization is asking you to question the ethics of abortion, or especially the safety of abortion, it's time for you to start questioning what their agenda actually is. Because not everybody who says they want to help actually wants to help. As we have mentioned the over 300 anti-abortion organizations that are currently operating in Canada, one of the questions that's being asked again and again is how are these organizations getting enough money to continue operating? And part of the answer to that is that about 70% of those organizations actually have charity status. This should not be the case. In 2021, the Liberal Party made a promise that upon re-election, they would no longer be providing anti-abortion groups with charitable status. This promise, which is still listed on the Liberal Party website, specifically points out crisis pregnancy centers as a problem because they provide misinformation to pregnant people about their rights and their options. With this campaign promise, the Liberal Party made it clear that they are aware of the problems with these organizations. Despite this, as of May 2023, over 200 anti-abortion groups are still listed as charities, including 145 crisis pregnancy centers. These organizations have been provided charitable status based on their claims that they give services that relieve poverty, advance education or religion, or give community benefit. In reality, these organizations are not doing that. What they're actually doing is spreading misinformation in order to promote an anti-choice agenda. Crisis pregnancy centers in particular often falsely advertise themselves as health clinics in order to do so. Despite the Liberal Party making it known that they're aware of the harm that these organizations cause, 2 years after re-election, they have done nothing to revoke the charitable status of these organizations. ARC has called for the removal of these groups as charitable organizations, as well as updating and modernizing the guidelines for what can be classified as a charitable group. In action, this could look similar to the guidelines for the Canada Summer Jobs Program, which disqualifies organizations for advocating for discrimination or for undermining access to sexual and reproductive health services. What we can all do is remind our MPs that we have not forgotten about this campaign promise and that we expect it to be fulfilled by the next election cycle. Great news has come out of British Columbia this month. At the BC NDP convention held last weekend, a resolution was passed that is going to safeguard evidence-based sexual health education in schools. This resolution was passed because there is evidence that anti-abortion groups have infiltrated some BC public schools by offering to teach sex education for free. This is a service that is primarily offered by crisis pregnancy centers, which purposefully misinform people seeking abortion. These groups have been delivering sex education programs in schools across the province. Additionally, ARC found that 40% of crisis pregnancy centers across Canada offer services like this. 2 ARC members helped in passing this resolution, which will work to ensure that educators in BC rely on evidence-based tools to deliver age-appropriate sexual health education. This means that any third parties delivering sexual health education cannot provide biased information or misinformation on consent, contraception, or abortion. Groups can also not be affiliated with religious organizations, oppose reproductive rights, or oppose the rights of 2S LGBTQIA+ students. Thank you to everyone who helped get this resolution passed, as barring misinformation from schools about sex, gender, abortion, and the human body benefits us all. Resolutions like this assist in helping equip young people with the knowledge to know how their bodies and minds work, giving them the best chance to make informed choices about their bodies throughout their life.